Please welcome Hydrostasis founder and CEO, Debbie Chen.
Zach, I didn't get a car. What happened to my car? Okay, just to be awesome, can everyone just have a little sip of water? I know we just had a coffee break, but more water is good. Hi everyone, my name is Debbie Chen. I am the founder and CEO of Hydrostasis. We build hydration monitoring wearables. I'm wearing, this one is our Gen 1 right now. I'll talk about our Gen 2 coming up. And of course, we are a customer of Edge and Pulse, so shout out to the team. And I'll talk about our work with the Edge and Pulse team in just a bit. As we're building for hydration, we realized that we're building all these great tools, right? We're talking about all the tools and the agents and all of these things, and yet our tools are only as good as the data that it's trained on, right? So this is what I'm talking about is the data equity and how we can address them as we build. So how many people are wearing wearables right now? Yeah, rings, smartwatches, right? We got all of them. So wearable devices can actually be life-saving for vulnerable populations, right? Or folks that can't get to their hospitals, places where it's not accessible. But also harmful biases are actually embedded within our wearables. But if we think about wearables as equity tools, we can actually build for such an amazing impact in a lot of different ways. This one study in 2024 actually shows that there's 5,000 wearable systems deployed across 22 countries, everywhere from the neonates all the way to geriatrics, right? So this is really, really impactful work. But again, our tools are only as good as the data sets that they're built on. So let's talk about technical biases. After COVID, we had a lot of issues with pulse oximetry. There's a lot of studies, and this one included, that showed that pulse oximetry is actually less accurate for folks with darker skin. So unfortunately, Black patients showed that they had 3 times more frequency of hypoxemia than compared to white patients. And this caused a lot of patients to be sent home, right? And when they really needed to be in the hospital. Sleep monitoring. We all love our sleep. We all love tracking our sleep. But what about cultural differences where families sleep in one big bed, right? Or, for example, if you have shift work, right? Are these models accounting for differences in our sleep patterns? And what about the one-size-fits-all designs? Accessibility, affordability, disability. In fact, one of the reasons why we chose this strap versus a normal watch strap is because we were targeting older adults and there's dexterity issues. So let's think about these technical biases and make them better. Did you know that women were not allowed in clinical trials until 1993? It's pretty absurd, right? So think about all of the treatments, all of the pharmaceuticals, all of the processes that were established before 1993, right? There were no data from women, unfortunately. And women are usually typically cast as smaller men, right? So this crash test dummy is 4'11" and 108 pounds. And then even the male is based on 1970s. Somebody decided this male is the average male, right? ADHD diagnoses are a lot different for girls and women, and so what happens is that females are less diagnosed, and then the symptoms are vastly different. Pain management protocols for women especially, endometriosis actually takes about 7 to 10 years to diagnose, right? That's insane. Productivity, we were just talking about temperatures in office buildings, right? This was built based on a 145-pound man, 40-year-old man wearing a business suit, 68 to 72 degrees. What happens is a lot of women are really cold in the office buildings, right? So again, let's think about why we set our temperatures at these temperatures and who are we serving. So we built better tools. Now we have great tools, amazing tools. Again, what are these tools using for data sets? It's really hard to read, so I'll go through this. But in this one study in 24 in the Lancet, they actually did prompts using clinical diagnostics, right? So 25 prompts for every single one of these indications. What ended up happening was that, unsurprisingly, GPT-4 overestimates numerous health conditions in Black patients versus white patients. Things like hypertension, HIV, multiple myeloma, prostate cancer, type 2 diabetes, and colon cancer. And again, unsurprisingly, GPT-4 underestimates conditions in women compared to men. Things like COVID-19, pneumonia, tuberculosis, hepatitis B, endocarditis, et cetera. Some of these are over 50%, right, underestimates. So again, let's think about the data sets that our tools are trained on. A couple things. Let's address these things, right? Think about inclusive design. Who are you building for? And actually, who is on your team? So one of the examples I'd like to mention is that for those of you that are Tesla owners, who do you think the folks are that the doors don't work? You have to stick your fingers in the doors, right? Folks with acrylic nails. It pops off their nails, right? Okay, niche market, and maybe if you're not targeting those folks, that's fine. But again, I guarantee you there was nobody with acrylic nails on the design team or the testing team, right? They would have noticed. R&D reform, what kind of data collection protocols are you using? Participant recruitment methods, and where are you recruiting from? Data governance, right? This is a big topic. California just passed SB 53 to protect whistleblowers and things like that. So we're on our way. But the regulatory folks are moving a little slower than our developers, right? So think about data equity, security, usability. Is this data set actually appropriate for what you're trying to do? Or are you scraping the internet for whatever you need, right? All right, so shifting gears a little bit to what I'm doing at Hydrostasis. I believe hydration is the missing vital sign. And the reason why is because if you think about all of these really great biometrics that we have, on our hands and in our rings and everywhere else in our ears, you kind of know what's good and bad, right? Heart rate, SpO2, respiratory rate, but we actually don't know that about hydration. So why is hydration essential? Well, improper hydration impairs everyday function. Heart health, muscle health, kidney health, brain function, overall human performance. But the problem is that if you have improper hydration, it actually increases the risk of hospitalization. We have about 10 million seniors that are hospitalized for dehydration every year. And it comes with a 20% increase risk of death. This is all preventable, by the way. Currently, our clinical hydration tests are severely outdated. So you have pinching the skin, which is very measurable. And then unfortunately, as we age, we also, the skin test doesn't work very well. You have tracking weights. So folks with heart failure or kidney disease are sent home to step on a scale. Well, that works sort of. But what are you wearing? What time of day? Did you just eat a big meal, right? It's hard to tell. And what kind of scale are you using? And then there's also swollen ankles and sunken eyes, and basically the doctor's best guess. So this is the state of the art, right? So we went out to solve that. So this is actually our Gen 1 product, the Gecko Watch. And we proved a couple things. We launched in 2024. We proved a couple things. One is that we sold out, so people really wanted this. Secondly is that we wanted to test our value props, right? So what kind of customer insights are we looking for? And the first thing is a real-time indicator. How hydrated am I right now? So we put it into 3 buckets: hydrated, mildly dehydrated, and dry. And then we also said, what do I need to know? Well, one thing I need to know is if I'm ready to do the next thing, right? I could be well hydrated right now, I could be in the blue, but if I'm gonna go for a run or something like that, do I need to hydrate more to stay in the blue? Right, so we put in real-time notifications as well. So we spent this last year learning about our customers, and we realized that simplicity is key. We're inundated with all this data, right? All we really need to know is if we're hydrated or not. I'm standing up here talking about data equity, and you think, oh, my data is very well balanced and amazing, right? Not so true. So we did okay with the female to male ratio. But then when we were looking at age, older adults don't really want to participate as much as younger adults. We were trying really hard to get a nice distribution on the weights and BMIs, because also current wearables don't work well for folks with higher BMI as well. And then, of course, we cared about skin tone, so we used the Monk scale from 1 to 10. And you can also see that my graph ends at 7. So we tried, and we try for better data sets, but again, it is difficult. So even with the effort that we put in, it is challenging. But it's worth it. Super excited to talk about our next launch. This is the Gecko Watch 2.0, where we've completely redesigned it with a sleeker look. We have our advanced algorithms. We moved the calibration to the background, so it's a smoother user experience. We added 2 new sensors for heat and physical exhaustion. And then for our heavy sweaters, we also added water resistance. And of course, the most important thing is our on-edge algorithm. And so shout out to the Edge Impulse team again. So we actually have an algorithm deployed on the Edge Impulse platform that we're currently testing for Gen 2. So why did we decide to do on edge, right? The cloud works just fine, right? Well, it actually opens up a whole bunch of different markets for us. The markets such as the military for data security and privacy, industrial workers, policemen, firefighters, folks that don't always have their phones with them or are constantly connected to the cloud. So we're excited about this, both on the technology side, of course, and also on the business side as well. Okay, so phones out, QR code is here. This is our website. Sign up for our wait list. These are actually pictures of our Gen 2 that came off of the production line last week. Super excited. My team is actually testing it right now. And so, yeah, really excited to show this off. So the one that you saw earlier and on my hand here is Gen 1, and this is Gen 2. So we're soft launching this year with a larger launch in Q1 next year. Okay, lessons learned. Number 1, data infrastructure is important, obviously. You guys all know this. My example is that we had a whole bunch of different studies, right? We're trying to collect the data, and we had a bunch of different studies, and we had inconsistent data storage. Some data sets have different metrics, other data sets were stored in different ways, and so that actually made a big headache for our team. So think about the data infrastructure and also, future data collection. Number 2, product features versus model performance. This is sort of the bane of all of these companies, right? Like you have your product team and your marketing team telling you want to do this, and then you have like the engineers that are trying to build the thing, right? So one example was that we moved to intermittent data, which is great. Clear product win because it extended battery life. Okay, well that was difficult for our data team because that meant that the data sets and the batches were inconsistent. And then also we had to aggregate for a longer time, right? So the lesson learned is that you got to have your product team and your modeling team really talk about these trade-offs. And you can't have one or the other just making those decisions because the other side will kind of get mad. Lesson number 3, build model observability. And we all know this. But one of the examples is that we had this really great model and it looked like it worked really well. And you use your accuracy and your recall and all of your metrics, right? But when we dug deep and then we looked at the predictions, it ended up being that this model, by and large, predicted one category, right? And so failures in the real world, such as like temperature variations, power variations, model compression, right? All of these impact your model on edge. And so building tools and obviously logging and things like that to observe every step of the way is important. And number 4, edge-first data processing. Most people start off cloud and then move to the edge, right? But as we know, everything is on edge. So if you're bringing new products, think about edge-first data processing and how is that different? Because it actually might be the difference between a viable and a non-viable product. Think about processing data, pipelines. Think about memory usage, battery life, incremental streaming data versus batch data, right? All of this ends up being impactful for your edge-first product. Don't worry if you're not taking any notes. It's all on this blog that just got published, I think yesterday. So I just wanted to shout out to Dr. Michelle Hugenhout, who is our lead data scientist that's working on this with the Edge Impulse team. She's not here today, but this is all of her work. OK, so questions to ask before you build, right? What is your mission? Who are you serving? And who are you building for, right? Who are your customers? Who's on your team? All of this is important because it goes into your mission and your why. And if we think about this stuff and we build our tools and our data sets, thinking through these things before we build, we can actually create better tools and more equitable data sets for all of us. Thank you.